which will be occurring in January 2011. So the preparation starts a year in advance, collecting supplies, asking donations from different foundations and different institutions. So these are pallets that you see behind us here. We are basically opening all of the boxes and see which ones are the ones that we immediately would need, and then the rest of the items we will take also with us and ship them to the Philippines and donate them to various hospitals, clinics, and organizations there so they can be used. A lot of this equipment, like for example, like a package like this cost about $50 to $100, and these are packages that they actually do not have in the Philippines. We have catheters, catheters like cardiac catheterizations that are worth hundreds of dollars, and they're not being used here, and they're usually just tossed out. So we could use this in the Philippines. So this is really such a great help. And these are all supplies from Stanford, and some of them from various foundations. This will be also donated not only to hospitals, but orphanages and other local villages there in the Philippines. So I'd like to interview some of our volunteers here. This is Lina Dacio, who actually was instrumental in encouraging me to participate in this project about 5 or 6 years ago. Lina, I'd like you to say something.
Good morning. We are here at the SBC Global Warehouse, and we're trying to get ready for the 2011 mission. We are proud to tell you that we are very honored to serve our country's people. And heading this mission this year is Dr. Julieta Gabiola, who has been with the mission now for the last 5 years. And she had a very significant contribution to this mission in that she had spearheaded 2 missions now for the country. The first one in Iloilo in last year, and this year again in Pampanga. And she's doing a marvelous job, and we can't do without her.
Thank you, Lina. And this is Helen Cadiente, who is a nurse at Lucille Packard Stanford University. Say something about the mission.
All right. Lina and I have been in the mission for the last 16 years. And the reason why I started the medical mission is because I didn't really work in the Philippines. I only had 10 months to serve the country. So I promised my husband when we get stable here in America that I will pay back. I will pay back the country at least 10 years. It is like an addiction. I mean, this is a good addiction because we keep going back every year, and I still have goosebumps when I think about it because it's an honor and it's a privilege, and it's a very rewarding experience to serve the poor and underprivileged people in the Philippines. And Dr. Gabiola is so, I mean, she is very energetic and a very good example of a leader that really can lead the whole global, ABC Global Medical Mission and the different resources that we have to serve the underprivileged people in the Philippines. And we are now sorting all the donations, and we are really we really appreciate all the contributions, and also this nice storage place that's being given to us as a gift. And thank you so much. I really, really am honored to be part of this medical mission. Thank you.
This is Jency Rohina, a pre-med student, and Noel Pineda, pre-med students. They're both graduates from Stanford University program. And I'd like you to share your experience thus far with the ABCs for Global Health and what you think this project is all about. And Jency is starting a research project on the prevention of hypertension and diabetes in the Philippines, and she will be on this immersion project for about 9 months in the Philippines. How exciting. So say something.
Yeah, so my experience so far with ABCs for Global Health has been a really fantastic one because as you see, there are so many people that are helping. So everything that we do, the medical mission, the research project on hypertension prevention, is a collaboration. So as a pre-med student, it's really exciting for me to be able to meet a lot of people and to work with them um, with the purpose of helping the underserved. You know, I'm really inspired every single day by everyone around me because everyone's so selfless and giving, you know, to everyone else. It's out of the goodness of their own hearts. It's not something that is required. So I'm just really grateful actually for the opportunity to be working with everyone else. You know, simple things, sorting medical supplies, go a long way in the long run. So this is just the beginning. We're building up, and I'm really excited.
And I've just gotten started just within the last couple of weeks or so, and it sounds like a phenomenal project. I'm just really excited to be a part of it. I think it's wonderful to give back to underserved and marginalized communities, especially in the Philippines where there are quite a few different sort of needs, especially healthcare needs. So really excited to learn more about what they're up to and just think it's going to be just the best experience.
So this is the rest of the group, and as you see, we have a lot more things to do. So we'll try to do a sorting out like almost every other week. This is my daughter, Michaela Finnegan, who had been really involved in the medical mission for the last 3 years, and she's also a pre-med student at Berkeley. I wonder if you could share your experience, Michaela, in terms of the medical missions.
They're pretty great experiences. I know my mom grew up as a poor kid in the Philippines, and I'd never really been able to experience that firsthand, even though I visited back home multiple occasions. So being able to see the types of people that we're helping and knowing that's where my family's from has been a really powerful experience for me. It's actually what encouraged me to go into medicine in the first place. So I like to stay involved, helping to sort medications, helping to head the health education on the missions so that hopefully we can create some lasting and sustainable change in the community.
So thank you very much.